Welcome to the session, the virtual open house for the Health Care Aide program. Unfortunately, we have no participants at this time, but we will review basically the programs that we offer through the Health Care Aide and what that entails. So welcome to your future. Here's a picture of students from the past in the lab, actually in Peace River. So we have a lab. We have a lab in Peace River, High Prairie, Slave Lake, High Level. Just depending on where the students are located is kind of where we utilize our lab and clinical space. So this is a group of students in the lab in Peace River. So briefly, I'll just touch on the Health Careers mission and vision statement. For health programs, we provide health education based on best practice. We want to graduate safe, caring, and competent professionals. Hello, Tanika. How are you? I just started. You're the only one in here, so I'll just continue to carry on. If you have any questions, type them in the chat box, or you can also, one second here. Raise your hand. Can you hear me okay? If you can, maybe just give me a thumbs up so that I can know that you can hear me okay. All right. So I was just briefly talking about the career mission and vision statement at the college, Northern Lakes College. For the health programs, we're a first choice online health education provider meeting health system and workforce needs. So whether it's, health care, practical nurse, paramedicine, excuse me, all of our health programs, we provide online health education. And as you may or may not know, there is quite the demand for health professions, especially in the north where we are primarily located. So if you're looking for a challenging and rewarding career in healthcare aid, the healthcare aid program prepares you to assist clients and be an integral part of the health team. So we deliver our program during the day online, so you can access it from your home. Usually, or Tuesday, Wednesday, Thursday afternoons is our classroom time. So you log in and you listen to the online instructor as she or he goes through the theory portion of the program. And then we have face-to-face labs and clinical. So that picture that I showed previously is our students in the lab in Peace River. So we come together approximately 4 times within the program to go over the skills and work hands-on with each other to practice the skills that we've learned online. And then we have clinical. So in our clinical, for the 3/4 of the clinical hours, we have you come where there's an instructor, and the instructor takes you to a long-term care facility. Right now, we're using one in Peace River, one in Grand Prairie, and one in Slave Lake. So you go with the instructor and go through basically the day of a healthcare aide, practicing feeding and lifting and toileting and bathing, all the activities of daily living. So what's really nice about this delivery is it allows you to stay in your home community for most of the part. There is that lab and clinical that you must travel to one of the sites that I mentioned. So you are required to be away from home if you don't live in one of those areas for part of the program. So again, here's another picture of our students in the Peace River lab. They're using what's called a Hoyer lift. So they are lifting the client up in the lift. So we have 2 people working that lift, and then we have our client who is being transported. This is for someone who isn't able to walk on their own. So they're going to probably go from bed to a wheelchair and then back. So we have 2 types of delivery for the Health Care Aide program. We have our E-STEP program for students who are working as an uncertified healthcare aide. So if you have a job as an uncertified healthcare aide and you want to get your certification, you can apply to our E-STEP program. You have 12 months to complete it, and we intake 5 times a year. So 5 times a year you can apply, which gives you lots of options for, when you'd like to start. And the approximate cost is just over $3,300. What's nice about the E-STEP program is if you are working as an uncertified healthcare aide, you can use your hours that you work to count towards your clinical hours. So basically you're getting, your job hours where you're getting paid can also use for your clinical hours. So that is nice. You don't have to travel because you're working, in that community, and you get to use those hours. You do have, like I mentioned, 12 months to complete, but you may complete it sooner, depending on what you're able to do with working and your family life. You can definitely complete the program on a faster timeline. And then we have our full-time program, which is geared towards, someone who's never worked in the healthcare aide field or, is not currently and would like to certify. So we intake in September once a year, and we finish approximately the end of May, first week of June. And then you would have your healthcare aide certification this way, and the cost is approximately $5,700. Now, that's not including if you do need to travel. Students are responsible for their own accommodations and travel. There is some bursary options for when you complete. You can also apply for some of those. So that is the 2 options that we have. Okay. Thank you, Tanika, for joining and listening to my little presentation. And hopefully we see you as a student in the future.